Hello, thanks for taking the time. Dr. Barry Reed, Mason Spine and Injury Center here in the greater Cincinnati area. Talk about playing the game of Jenga. Jenga is the game that has blocks and you stack them up in all different directions. And typically 2 or 3 people or maybe a family of people play the game. And the object of the game is to pull one of the blocks out without knocking the rest of the stack of blocks down. So, how easy would it be to play Jenga with your eyes closed? Wouldn't be very easy, would it? The ability to play Jenga is made much more easily done if you can see what you're looking at, if you can assess and understand where the blocks are in relation to the stack. Some of you already see where we're going with this, right? So this Jenga stack is in certain ways, in many ways actually, related to the vertebrae, the column of bones in our neck and in our back. They stack one on top of another. And they're supposed to be in a certain position. And if they are where they are supposed to be, they will move like this or like this in relation to each other. The problem is when one of them gets moved out a little bit, they don't want to move very easily. So we put them back in the right place to restore the normal pain-free range of motion. So let's take this idea a little further, the Jenga idea. Let's say that you have some neck pain or some low back pain or some pain over here, and you go to the chiropractor, and the chiropractor does not take x-rays. What do you think the likelihood of being able to know exactly which vertebrae it is that's causing the pain and which way has it moved without any images? Is it going to be good? Is it going to be efficient? Is it going to be effective? Maybe. You may be able to guess when you're playing Jenga and pull one of the blocks out without knocking over the stack. But I don't think that over a long period of time that you'll find that closing your eyes and playing Jenga is going to be a good idea. And I can tell you for sure that there's not many good, experienced, reasonable, level-headed chiropractic physicians that will work on your neck or your low back without having all of the information that they can to make sure that it is safe and effective. If your C5 is moved over this way, and it should be right here, then I need to know. Because if it's moved over this way, I don't have any imaging, and I move it a little bit more this way, instead of moving it back to where it's supposed to be, what do you think that's going to turn out like? That is the difference between having effective chiropractic-based treatment and doing guesswork. We do imaging in this office. Now, we don't have to take the imaging. We can if we need to. It's very convenient. It's right across the hall from our initial consultation room. If we need to take an image of your neck, we do. And guess what? I'll show you. I'll show you the vertebrae, and I'll show you that one of them is out of position like this, or compressed like this, or over here, or over here, or over here. And guess what? We build a plan around that and the other relevant information that you have brought to us or that we have found with each other as being a patient. So, if you want to go to a chiropractic office that doesn't take imaging for $29 for an adjustment and do some guesswork, then be my guest. But if you want to go to a place that finds the problem and can put a very efficient, accurate treatment plan together based on something that is third-party, legitimate, and never lies, imaging, x-rays, or MRI, then you found the place to go. Again, thank you for taking the time. Dr. Barry Reed, Mason Spine and Injury Center here in the greater Cincinnati area. Call us. We'll be ready to help. Have a great day.